Hello and welcome to all of you. This side Dr. Saurabh Bhatia and I'm your Pharmacology Guru. And today we will be discussing the 10 most important questions which can be asked in your upcoming NEET exam. So let's start with question number one. So question number one is based on one antifungal drug, and the question is which antifungal possesses anti-androgenic property? So the answer here is ketoconazole. So if we talk about these medicines, if you noticed one thing, all the medicine ends with a common word that is known as azoles. So this group of antifungal known as azoles. And if we talk about the mechanism of action of these medicines, these drugs are inhibitor of an enzyme known as 14 alpha demethylase enzyme. So these antifungals are 14 alpha demethylase enzyme inhibitor. And by inhibiting 14 alpha demethylase enzyme, these drugs will inhibit the synthesis of cell membrane. So fungal cell membrane synthesis will be inhibited if I block the 14 alpha demethylase enzyme. Medicines are known as azoles. Now, if we talk about the drugs which belong to this class, so we have the medicines like fluconazole, itraconazole, clotrimazole, ketoconazole. Now, if we talk about these medicines in further detail, I would say ketoconazole is a drug. Now, this medicine nowadays not used as an antifungal by systemic route. So I can use this medicine by topical route as an antifungal. But being a systemic drug, I can use this medicine as a drug of choice for Cushing's disease. So this medicine is used as the best medicine for the treatment of Cushing's disease. So ketoconazole is a drug which has multiple actions in the body. This medicine can inhibit the synthesis of cortisol in the human body. Now, apart from cortisol inhibition, this medicine can also inhibit the testosterone synthesis in the human body. So both cortisol and testosterone are the steroidal hormones. So ketoconazole are inhibitor of these steroidal hormones like cortisol and testosterone. So by inhibiting cortisol, this is given as a best medicine for Cushing's disease, or you can say that this medicine has a property to inhibit the adrenal gland activity or adrenal cortex activity. Now, because this drug is inhibitor of testosterone also, this medicine has anti-androgenic property. So by inhibiting testosterone in the male body, this medicine will lead to predominance of estrogen action in the male body. So in male body, we have small quantity of estrogen. If I block the testosterone, then the small amount of estrogen will dominate over this testosterone action. And ultimately, the patient will have a very serious side effect. We call it gynecomastia. So males can develop gynecomastia as an important side effect of ketoconazole. If we talk about other medicines given in this MCQ, for example, the drug is fluconazole. Now regarding the fluconazole, guys, you people have to remember that this is a drug of choice for Candida albicans. This medicine is drug of choice for Candida albicans infection. And being a dentist, you should be knowing oral candidiasis. Oral candidiasis is a condition where the patient will have the candida infection of the buccal cavity. This might be a complication of inhalational steroid therapy, right? So this might be a secondary infection, can be seen in those patients who are immunocompromised, but can be a side effect of inhalational steroidal therapy. So patient can develop oral candidiasis, oral thrush as a side effect of steroidal therapy by inhalational route. Now, fluconazole is overall best medicine to be given for the treatment of oral candidiasis and oral thrush. But whenever we treat oral candidiasis or oral thrush, we have to give initially the local drugs, the topical drugs, right? So clotrimazole and nystatin. So there is one more drug name is nystatin. So clotrimazole and nystatin are the two medicines which are given by the topical route. So these medicines are given by the topical route or by the local route. So we can say that medicines can be given by local or the topical route for the treatment of oral thrush or oral candidiasis. Now, out of these two, if you have to choose one, I suggest you to go and choose the answer as clotrimazole. So clotrimazole is a better drug than the nystatin, right? So out of clotrimazole, nystatin, which are both given as a drug for oral candidiasis by the local route, clotrimazole has a better answer. Now, nystatin is a drug when given to a patient. This medicine contains a sweetener that can cause dental caries as a side effect. So, because of the sweetener present in the structure of this medicine can cause dental caries, which is something not acceptable. So, clotrimazole is a medicine which is preferred over nystatin for the treatment of oral candidiasis by topical or by the local route. Now, if we talk about the other medicines like itraconazole given in this question, now itraconazole is a medicine. This drug is considered as best medicine for the treatment of skin infection, the fungal skin infection. We also call it dermatophytes. right? So dermatophyte infection, which is also known as tinea infection. So tinea infection, we have multiple types of tinea infection. For example, tinea versicolor, tinea cruris, tinea corporis. So we have multiple types of skin infections. Now skin infections are also known as dermatophyte infection, also known as tinea infection. So itraconazole is one of the leading drug that can be given for the treatment of such kind of skin infection. Now, apart from these 4 or 5 antifungal drugs that we have covered over here, we call them azoles. We have some other medicines also which can be asked in your exam. For example, there is one drug, the drug name is voriconazole. Now, voriconazole is one more drug, that is azole. Now, this medicine is drug of choice for aspergillosis. Now, any patient who has aspergillosis, voriconazole is the best medicine to be given. Now, apart from voriconazole, we have a drug. The drug name is liposomal amphotericin B. So liposomal amphotericin B is a medicine. This medicine is considered as drug of choice for mucormycosis. So liposomal amphotericin B, drug of choice for mucormycosis, which is also known as black fungus. So drug of choice for mucormycosis, answer is liposomal amphotericin B. Now this medicine is also drug of choice for one very serious fungal infection. We call it cryptococcal meningitis. So this is a drug of choice for cryptococcal meningitis, as well as this medicine is drug of choice for Kala Azar, that is also known as visceral leishmaniasis. So this medicine is drug of choice for visceral leishmaniasis, also given for cryptococcal meningitis and mucormycosis. So these are the some important antifungal which can be asked in your exam, and these are important to be remembered. So question number 1, answer is ketoconazole. This medicine has anti-androgenic property. It can block the testosterone, can cause gynecomastia as a side effect. Now let's move on to question number 2. A female had myocardial infarction. Now her father had a history of the same kind of event which is followed by death. Now the doctor has prescribed atorvastatin to female. Now what is the mechanism of action of this medicine? Now, this question is simple and straightforward. Atorvastatin belongs to a class of drugs, we call them statins, and these medicines are the competitive inhibitors. These medicines are the competitive inhibitor of HMG-CoA reductase enzyme. So these medicines, which are known as statins, these medicines are HMG-CoA reductase enzyme inhibitor, and these are the drugs which are the best medicine to reduce the level of cholesterol in your plasma. Now, guys, you must be knowing cholesterol is the one that will mainly flow in your plasma in LDL. So, any drug that is best to reduce cholesterol will also be the best medicine to reduce the level of low density lipoprotein or the harmful lipoprotein that will deposit the cholesterol in your blood vessel. So, we will say that statins are the best medicine for the treatment of hypercholesterolemia. Now, these statins, when given to a patient, what is the mechanism of action? So, mechanism of action we people have already covered. It is a HMG-CoA reductase enzyme inhibitor. So, this is inhibitor of HMG-CoA reductase enzyme and therefore reduce the level of cholesterol. Now, if we don't know about the side effect of this medicine, what can be the side effect of the statins? We will say these medicines can cause hepatotoxicity. So these drugs can result in hepatotoxicity as a side effect. These medicines can also cause myopathy as a side effect. So medicine side effects are myopathy, hepatotoxicity. Drugs can also result in hyperglycemia. So these medicines can also result in hyperglycemia as a side effect. And from this G, you can also remember these medicines should not be given to gravida females. Now, gravida females are those females who are pregnant. So medicines should not be given to gravida females. Medicines can cause hyperglycemia. Medicines can cause myopathy, hepatotoxicity as a side effect. Now, apart from that, we people have already covered. These are the drug of choice for hypercholesterolemia. So CO stands for hypercholesterolemia. So hypercholesterolemia, these medicines are the drug of choice to be given. Now, among all the medicines, please remember, we prefer to use these medicines. Most of the medicines are best to be given after dinner. So these medicines are best to be given after dinner or after the evening meal. So these medicines are best to be given after dinner or after meal. Now from this reductase we have a R. Now from this R you can remember the most efficient statin is rosuvastatin. So rosuvastatin is a drug which is the most efficient statin to be given clinically. Now after rosuvastatin, the second most efficient statin is atorvastatin. So rosuvastatin, atorvastatin are two most efficient statins which can be given to a patient. And these medicines are the long-acting medicines. And because these medicines are the long-acting drugs, they can be given at any time of the day. So these medicines can be given at any time of the day. It's not necessary, just like other statins, that medicines are always be given at evening time or night time. So these medicines can be given at any time of the day. So we call them statins. Now, along with cholesterol, we have one more component in our lipid profile report. The second component in the lipid profile report is known as triglyceride. Now, which medicines are the best medicines for the treatment of triglyceride? So, if any patient who has high level of triglyceride, we want to reduce the level of this triglyceride. Now, triglyceride is the one which will flow in our VLDL, very low density lipoprotein. So, any drug that will reduce the level of triglyceride automatically reduce the level of VLDL in the body, right? Now, which medicines are drug of choice? Which medicines are best to be given to this patient to reduce the level of triglyceride? Answer is known as fibrates. Now, among fibrates, we have a drug fenofibrate. So fenofibrate is a medicine that belongs to a class of fibrate. So this medicine is overall drug of choice, best medicine for the treatment of hypertriglyceridemia. Now, when this medicine is given to a patient, just like statins, this medicine can also lead to the same side effect as HMG. Plus, this medicine can also result in formation of gallstone. So, formation of gallstone can be seen with the use of fenofibrate as a drug for hyperlipidemia or hypertriglyceridemia. If the question is asked to you, what is the second drug of choice for hypercholesterolemia? So again, I'm moving back to cholesterol level because cholesterol is something which is harmful for us that will mainly deposit in your blood vessel. So what is the second drug of choice for hypercholesterolemia? So here you can find out the drug is PCSK9 inhibitor. So medicines are known as PCSK9 enzyme inhibitor. So we have a drug over here. Drug name is evolucumab. So evolocumab is a medicine which is PCSK9 inhibitor, can be given as a second drug of choice for hypertriglyceridemia. Now in this name of evolocumab, we have a MAB, that is monoclonal antibody. And before this monoclonal antibody, we have a word, we call it CU. So this drug can result in cholesterol uptake in the body. So this medicine can cause cholesterol uptake in the liver so that the level of cholesterol will reduce in plasma. So liver will start taking up cholesterol from plasma, and now this cholesterol will enter in the liver. So we have less amount of cholesterol will flow in our plasma. So there will be less deposition in the blood vessel. So evolocumab is a PCSK9 inhibitor. It's a second drug of choice for hypercholesterolemia. Now let's move on to question number 3. Question number 3 is based on the medicines that are given for the treatment of osteoporosis. So we have a drug known as raloxifene. Now raloxifene is a drug. This medicine is given for the treatment of osteoporosis in postmenopausal female. So this question is based on the medicines which are given for the treatment of osteoporosis. So if we talk about medicines which are given for osteoporosis, we can grossly divide these medicines in two classes. So I can say there are some medicines which can increase osteoblast activity and result in bone formation. Medicines which will result in osteoblast activity result in bone formation. So we call these medicines as anabolic drugs. So we call these medicines as anabolic drugs because they will lead to bone formation in the body. So which medicine belong to this class? So we have a medicine, the drug name is teriparatide. So teriparatide is a drug which is parathyroid hormone analog. So this medicine is parathyroid hormone analog, and because this is a parathyroid hormone analog medicine, this medicine can result in bone formation. Now, apart from these medicines which can result in bone formation, we have a different class of drugs, the medicines which can inhibit the osteoclast action. Drugs which can inhibit the osteoclast activity. So the medicines that can reduce the osteoclast activity, we call them anti-resorption drugs. So these medicines are known as anti-resorption drugs because osteoclasts are the special cells which can result in bone resorption. They can remove the bony tissue. So any bony tissue which is dead or inactive, this osteoclast can remove that bony tissue. So osteoclast, if you inhibit, then this is known as anti-resorption effect of the medicine. Osteoblasts are not inhibited, only osteoclasts are inhibited. So osteoblast will result in bone formation, but osteoclast cannot remove the bone tissue. So there is a more bone formation that will ultimately take place. So which medicines are inhibitor of osteoclast activity? So we have a group of medicines, we call them bisphosphonates. So bisphosphonates are overall drug of choice for osteoporosis. So any type of osteoporosis these days, like whether it is a female osteoporosis, postmenopausal osteoporosis, premenopausal osteoporosis, Males can also have the osteoporosis in patients who have androgen deficiency, testosterone deficiency. Malnutrition can lead to osteoporosis. So any male or female is having osteoporosis. These days, bisphosphonates are the drug of choice. Now, apart from bisphosphonates, we also have this medicine. The drug name is raloxifene. Now, raloxifene is a drug. This medicine belongs to a class of SERM. So, this is a selective estrogen receptor modulator. So, the full form is selective estrogen receptor modulator medicine. So, this medicine will act on estrogen receptor and inhibit the multiplication of osteoclast. And once it inhibits the multiplication of osteoclast, I can use this medicine in female patient for the treatment of postmenopausal osteoporosis. Now, raloxifene, when given to a patient, this medicine will act on estrogen mechanism. And because the drug will act on estrogen mechanism, what I will do, whenever I give this medicine to a patient, this medicine will take care of the osteoporosis. But there is a problem which the patient has to suffer from. The patient has to suffer from menopausal symptoms. The patient has to suffer from menopausal symptoms, like the patient can have the dry skin, dry vagina, atrophy of breast. All these kind of menopausal changes can be seen in a female body. Hot flashes can be there. So raloxifene has a problem of menopausal symptom. Apart from menopausal symptom, this medicine can also increase the risk of thromboembolism. So this medicine can increase the risk of thromboembolism also. So overall, best medicine is bisphosphonates. If we talk about this bisphosphonates further, bisphosphonates are the medicines which ends with the word dronate. So all the medicine ends with the word dronate. So just remember, drones are the best medicines for your osteoporosis. Now, what are the important side effects of bisphosphonates? So if we talk about side effects of bisphosphonates, most common side effect of bisphosphonates is esophagitis. So most common side effect is esophagitis. So whenever you take the medicine by oral route, the most important side effect of the medicine is esophagitis. Most common is esophagitis. So while crossing the esophagus, these medicines will come in contact with the esophageal wall and can damage the esophageal wall. The most common side effect is esophagitis. And how we can avoid the interaction of the drug with the esophageal wall? Like what we can do, we can take this medicine with ample amount of water. So patient can take high amount of water so that the medicine will take less time to cross this esophagus. So medicine will not be able to damage the esophagus. Plus, after taking the medicine, the patient should remain in upright posture, right? So patient can take this medicine with high quantity of water, and patient should remain in upright posture at least for 30 to 40 minutes after intake of drug. So patient should remain in upright posture. Number two side effect of this medicine is GERD and peptic ulcer disease. So these medicines can also cause GERD and peptic ulcer disease. And for this, we will give proton pump inhibitors as the best medicine. Number three side effect is these medicines can also cause hypocalcemia as a side effect. Now for this hypocalcemia, we again will not stop the medicine. We will give calcium supplement to the patient along with the bisphosphonates. Now apart from that, we have a fourth side effect also. These medicines can result in bone pains as a side effect. Now, bone pains is something which is very important to know here because these medicines, when given to a patient, these medicines will result in excessive bone formation. Now, because of the excessive bone formation, the bone resorption is not taking place because you people have blocked the osteoclast. Only the bone formation is taking place. Now, as a result of that, what will happen? As a result of that, the bone physiology, the bone main physiology or the normal physiology get disturbed. As a result of that, the patient can have the bone pains. So patient can have the bone pains when there is an excessive formation of bone that will take place, but the bone resorption is blocked by the medicine. Now, this is the time when you are supposed to stop the medicine. This is the time when you are supposed to stop the medicine when these bone pains will occur. Right? And how long you will stop the medicine? You can stop the medicine for a long time. Like you can stop the medicine till 2 to 3 years. You can stop the medicine till 2 to 3 years after stopping the medicine, and then you can restart. So please remember, these medicines, when given to a patient, these medicines remain in the bone for a longer time. And when these medicines remain in the bone for a longer time, once there is an excessive function of the medicine has taken place, it's better to stop the medicine for a few years, then you can restart after some time. Now, when these bone pains will appear and you will not stop the medicine, what can be the complication that can occur? So patient can have the femur bone fracture or the femur head fracture. So patient can have the femur head fracture as a side effect, and patient can also have the osteonecrosis of jaw. So patient can have the osteonecrosis of jaw. Patient can also have the femur head fracture. So femur head fracture and osteonecrosis of jaw can be seen with the use of this medicine if you will not stop this medicine at a proper time. So femur head fracture and osteonecrosis of jaw can be occur, and this is maximally seen with the longest acting medicine of this class. This side effect is maximally seen with longest acting medicine of this class, that is known as zoledronate. So zoledronate is the one which is maximally associated with this risk of femur head fracture and osteonecrosis of jaw. They call it zoledronate. Now, how we can avoid these problems of bone pain and femur head fracture or osteonecrosis of jaw? So answer is we can avoid the side effect of the medicine by following the rule that all these bisphosphonates should not be given for more than 5 years continuously. So we have three medicines over here. One starts with A, that is alendronate, ibandronate, risedronate. So three medicines should not be given beyond 5 years of treatment continuously. Otherwise, these complications can occur. But zoledronate is a long-acting medicine already. So this medicine should not be given continuously more than 3 years. So zoledronate should not be given continuously for more than 3 years if this complication will occur. To avoid this complication, right? So in order to avoid this complication, zoledronate should not be given for more than 3 years, and AIR, that is alendronate, ibandronate, risedronate, should not be given for more than 5 years. This is question number 3 regarding the drug viloxifene. This is given for postmenopausal osteoporosis as a drug which is inhibitor of osteoclast activity. Now let's talk about question number 4. Editing team, please remove this pause. So question number 4 is based on adrenaline administration during anaphylactic shock. So how this adrenaline is given to a patient during the treatment of anaphylactic shock? So the answer is by intramuscular route. So this question is based on treatment of anaphylaxis. And guys, we know that anaphylaxis is a type 1 hypersensitivity reaction. And in this type 1 hypersensitivity reaction, IgE, mast cells, and histamine are involved. So which all medicines can be given for the treatment of anaphylaxis? Number 1, I can use the antihistaminic drugs. So antihistaminic medicines can be used. For example, I can use the medicine, the drug name is diphenhydramine. So I can use the medicine like diphenhydramine. I can use the medicine like promethazine. I can use the drug like cetirizine, levocetirizine. All these medicines can I use for the all these medicines I can use for the treatment of this allergic reactions, that is antihistaminic drugs. So these medicines are given for the mild reactions. Now, when the patient is having moderate reaction, along with antihistaminic, I can also give the steroids. The steroids can be given to this patient. So we have a steroid, we call it hydrocortisone. The steroids like hydrocortisone can be given by IV route, but we have an oral steroid also like prednisolone. So prednisolone can be given by oral route. Number 3 medicine which I can use over here is adrenaline. Now, adrenaline is a medicine. This medicine is considered as the best medicine to take care of the shock that might be associated with anaphylaxis. So this is overall the best medicine for the treatment of anaphylactic shock. So adrenaline is the best medicine to be given for the treatment of anaphylactic shock. It's the best medicine to be given. Now, the 4th medicine that I can use over here is salbutamol. So salbutamol is a bronchodilator. So this is a beta-2 agonist. So this medicine, which is beta-2 agonist, is a bronchodilator, can be given rarely for the treatment of anaphylactic shock. So these are the 4 medicines which can be asked in relation to the anaphylactic shock. So here the most important drug is adrenaline. So this medicine we will discuss in detail. So how this adrenaline is given to a patient. So we talk about the dosage of adrenaline for the treatment of this anaphylactic shock. So please remember, adrenaline is a drug. This medicine is available in different types of formulation. So what are the different formulation? Number 1, adrenaline is given in a formulation 1:1000. So 1:1000 dilution of adrenaline is used for the treatment of anaphylactic shock. So for the treatment of anaphylactic shock, we can give this medicine in a dilution that is 1:1000 dilution. And how much is the dose? The dose of the medicine in an adult patient. The dose of the medicine in an adult patient is 0.5 milligram. Now this 1:1000 solution of this medicine contains 1 milligram drug per ml. So if I have to give 0.5 milligram of the drug, I have to give 0.5 ml of this liquid to this patient. So 0.5 ml of this liquid I have to give to the patient by intramuscular route. So by intramuscular route, I will give the medicine to this patient. Now, which muscle I will use most commonly? I will use the muscle most commonly as vastus lateralis. So vastus lateralis is a muscle that I can use. So thigh muscle, vastus lateralis is a muscle which I will use most commonly. The upper one third of this muscle, I will give the injection over there by intramuscular route. This is how I will give this medicines to a patient. Now, why I will not give this medicine by IV route? The reason is when I give this medicine by IV route, there is a risk of arrhythmia. And because of the risk of arrhythmia, I will prefer to give this medicine by intramuscular route. Now, can I give this medicine by subcutaneous route? Answer is yes. I can give medicine by subcutaneous route also. But when I give medicine by subcutaneous route, the drug absorption is very slow, right? And because of the medicine absorption is very slow by subcutaneous route, I have to use this route only in a stable patient. So any patient who is your stable patient, I can give this medicine by subcutaneous route. So in a stable patient, I can give medicine by subcutaneous route, but in unstable patient, the best route is intramuscular route. The next question is, can I give medicine by IV route? Answer is yes. I can give medicine by IV route also, but I have to give very less dose. Like in intramuscular route, the dose is 0.5 milligram. Now the dose is going to be 1.1 milligram. Now if I want to give zero point 0.1 milligram drug of this 1 is to 1000 solution, then I have to take only 0.1 ml liquid out of that, right? So I know that 1 ml is equal to 1 milligram, then 0.1 milligram is equal to zero point 0.1 ml. So what I have to do, it's not possible for me to take out the 0.1 ml liquid and give it to the patient. So what I will do for 0.1 milligram, I will use the second preparation of the Adaline, that is 1 is to 1000 preparation. So 1 is to 10,000 preparation of the Adaline is used, right? So 10,000 means the adaline is now 10 times more diluted. And because the adaline is now 10 times more diluted, this contains 0.1 milligram of drug per ml. Now can you see the relation? 1 is to 1000 is 1 milligram per ml. Now this is 1 is to 10,000, 10 times more diluted. So it is a 0.1 milligram per ml. So now here I have to give 0.1 milligram drug. So I will give 1 ml of 1 is to 10,000 liquid, and this is given by IV route. So this is how I will use adaline for the treatment of anaphylactic shock. So anaphylactic shock, adaline dosage and everything we people have discussed in detail. Now apart from that, if I ask you what are the other preparations of adaline which are available in the market, so I would say adaline is also given as a best medicine for cardiac arrest. So this medicine is best medicine for the treatment of cardiac arrest. Now for the treatment of cardiac arrest, this medicine is always used in a preparation 1 is to 10,000. So cardiac arrest, this is used in a preparation that is 1 is to 10,000, and the dose of the medicine is 1 milligram. So dose of the medicine is 1 milligram, which is equal to 10 ml of this liquid. So guys, we have already covered 1 is to 10,000 means 0.1 milligram drug is present in the 1 ml. So what I can do, I can use 10 ml of this liquid, that is going to be total 1 milligram, and this is given best by the intravenous route. And if intravenous route is not possible because patient is in cardiac arrest, patient veins are already collapsed, I can give this medicine by intraosseous route also. I can give medicine by intraosseous route also directly in the bones. But when I give this medicines in the bones, which bone is most commonly used? Answer is tibia bone. So I can give this medicine directly in the tibia bone. Now, apart from that, adaline has one more preparation, that is 1 is to lakhs. So adaline can be diluted lakh times. So this can be 1 is to 2 lakh, 1 is to 4 lakh, 1 is to 6 lakh. Different types of lakh time dilutions of adaline is there. Now this is given along with local anesthetics. So I can use this medicines along with local anesthetics for in this lakh time dilution. So drug can be used in lakh time dilution as a local anesthetic drug. Now, apart from that, I can also directly soak my gauze. So I have a gauze in my hand. I can directly soak in the adaline solution and can be given for epistaxis, can be given for any bleeding which is coming out from the gums. So 1 is to 1000 can be given by the topical route also. I can use it by topical route also to stop the bleeding. So 1 is to 1000, I will just dip the gauze and just apply over here. This will cause vasoconstriction and can stop the bleeding. So these are different types of preparation which I can use of adaline for different types of indications. So please remember, for anaphylactic shock, we people have covered. It is used in 1 is to 1000 dilution. For cardiac arrest, it is always used in 1 is to 10,000 dilution. 1 is to 1 lakh or multiple times of lakhs like 2 lakhs, 4 lakhs, 6 lakhs can be used with local anesthetics. And by topical route again, we use this medicine in 1 is to 1000 times dilution. So question number 4, answer is C, intramuscular route. Now let's move on to question number 5. Now, question number 5 is regarding an antibiotic. Which antibiotic can bind to calcium in the tooth? So, answer is tetracyclines. So, tetracyclines are the medicines. They have the tendency to bind with the calcium, and because this can bind to the calcium, this can interfere with the growth of bones and teeth. So, tetracyclines can interfere with the bones of teeth, growth of the bones and the teeth, and therefore these medicines are contraindicated in pregnant females as well as they are contraindicated in children less than 7 to 8 years of age. The children who are less than 7 to 8 years of age or females who are pregnant, these medicines are contraindicated. Now, if we talk about the other medicines, important side effects, for example, macrolides. Now, macrolides are the drugs which can cause diarrhea as a side effect. So, these medicines can increase the peristalsis, and because they can increase the peristalsis, these medicines can lead to diarrhea as an important side effect of this medicine. If we talk about aminoglycoside as a drug, what are the important side effects of aminoglycosides? The aminoglycosides are the medicines which can cause nephrotoxicity. So these medicines can damage the kidney, and when these medicines will damage the kidney, as a result of that, various ions are lost from the body. So these medicine can cause loss of various ions from the body, like magnesium and potassium. As a result of that, the nerves cannot conduct properly. Nerves conduction will get disturbed, so patient can have the neurotoxicity. And one of the nerve which is not able to work properly is the eighth nerve, that is also a sensory nerve that requires these magnesium and the potassium ion in the endolymph of the ear so that the nerve can fire properly. So patient can have the hearing problem, ototoxicity can be there. Apart from that, these medicines also get concentrated. These medicines also get concentrated in the inner ear. And when these medicines get concentrated in the inner ear, one more reason why these medicines can damage the eighth nerve directly. So these medicines can cause nephrotoxicity, hypokalemia, hypomagnesemia, neurotoxicity, ototoxicity. Apart from that, please remember, these medicines are also teratogenic drugs. So they will concentrate in the ear, can interfere with the growth of inner ear in a child. Now let's talk about the beta-lactam antibiotics. Now what are the side effects of beta-lactam antibiotics? So one of the very important side effects of beta-lactam antibiotic is hypersensitivity reaction. So beta-lactam antibiotics can cause hypersensitivity reaction. And now if we have to tackle this problem of beta-lactam hypersensitivity, we have to move on to the alternative drugs. So what are the alternative of beta-lactam antibiotics? So I can say azithromycin, which is a macrolide, can be used as an alternative of beta-lactam. If azithromycin is not there in the MCQ, you can also mark the cotrimoxazole. So cotrimoxazole is one more alternative of the beta-lactam antibiotic. So beta-lactam antibiotics, the oral alternatives are azithromycin and cotrimoxazole. Now one more alternative of beta-lactam is IV vancomycin. So in case you want a alternative by IV route, vancomycin is a medicine that is given by the intravenous route, and azithromycin, cotrimoxazole are the medicines they are given by the oral route as an alternative of beta-lactam. Number two problem with this medicine is these medicines are the broad spectrum drugs can result in pseudomembranous colitis. So beta-lactam antibiotics can damage the normal gut flora and can result in infection of the gut. Side effect is known as pseudomembranous colitis. Now, if we talk about the pseudomembranous colitis, the drug of choice to treat the pseudomembranous colitis is fidaxomicin. So fidaxomicin followed by the vancomycin. So fidaxomicin, vancomycin are the drug of choice for pseudomembranous colitis, and both of these medicines are given by oral route for the treatment of the pseudomembranous colitis. Apart from that, whenever we give beta-lactam antibiotics in CKD patients, these medicines can result in seizures as a side effect. Now, this seizure incidence is maximally seen. The seizure incidence is maximally seen with the drug, we call it imipenem. So, imipenem is a drug which has a maximum incidence of seizure caused by these medicines. Right? Number four, these medicines, when given to a patient, like particularly there is a drug ampicillin. So ampicillin is a medicine when given to a patient. This medicine can cause skin rashes as a side effect. So this medicine can cause skin rashes as a side effect. So medicine can cause skin rashes as a side effect. Now, apart from that, the last side effect of the medicine is we have some cephalosporin over here. For example, we have a cephalosporin cefoperazone. So there is one cephalosporin which you can remember, important for your exam, cefoperazone. Cefoperazone is a drug which can interfere with vitamin K activity. And when this medicine will interfere with the vitamin K activity, this can result in bleeding as a side effect. So this can result in bleeding as a side effect. So cefoperazone by interfering with vitamin K can cause bleeding as a side effect. Apart from that, cefoperazone when taken with alcohol, when this medicine is taken up with alcohol, can result in disulfiram-like reaction. So this medicine can also result in disulfiram-like reaction as a side effect. So these are some important side effects of antibiotics that you should keep in your mind. And regarding this tetracycline, you must be knowing this medicine interferes with the teeth and the bones, right? So these medicines can cause discoloration of the teeth, can result in malformation of the teeth. So these things, kind of things can be there with the tetracycline usage during pregnancy or in early childhood. So question number 5, answer is tetracyclines. Now let's move on to question number 6. Which drug is useful for managing thalassemia patient given parenterally? So any patient who is a case of thalassemia, this patient will get the repeated blood transfusion. So this patient will get the repeated blood transfusion, and because of the repeated blood transfusion, this patient will be having the iron overloading. So this patient will be having the iron overloading. Now, whenever the patient is having iron overloading, we have to use the iron chelating agents. We have to use the iron chelating agents. So the drugs that will bind to iron and remove the iron out of the body. Now, these iron chelating agents can be given by oral route, can be given by parenteral route, or by the IV route. Now, the oral chelating agents are given to asymptomatic patients. So, patients who have iron overloading, but they are not having any symptom because they are the thalassemia patient, they have to undergo blood transfusion. So, all of them would be having this iron overloading, but there is not a possibility that they always have the symptoms, right? So, they are asymptomatic patients. So, these patients don't require medicine by IV route, they require medicine only by the oral route. So oral medicines given to asymptomatic patients. Now, which medicines are given by the oral route? So we have the options which are given in this MCQ like deferipon. So we have the medicine like deferipon. So we have a drug like deferipon. We have a drug like deferasirox. So deferasirox, deferipon are the two medicines which can be given by the oral route. Now the medicines that is given by the IV route, this is given to a symptomatic patients. This is given to a symptomatic patient, and the drug that belong to this class is desferoxamine. So the drug name is desferoxamine, which is also known as deferoxamine. So deferoxamine, desferoxamine is same thing. So these medicines are the chelating agents. Iron chelating agents can be given to a patient to take care of the iron overloading. So question number 6 is based on iron overloading, and they have asked the medicine to be given by the parenteral route. So here the answer is deferoxamine. So deferoxamine is the best answer. Second name of this drug, same drug, is desferoxamine. But please remember this deferipon which is given over here, this is given by the oral route, not given by the parenteral route. This is all about question number 6. Now after this question number 6, let's move on to question number 7. So we talk about question number 7. This is based on a very important class of antihypertensive drugs. We call them ACE inhibitors. So ACE inhibitors are the antihypertensive drugs. So guys, please remember there are three group of medicines which are the first line drugs for hypertension. So if I say which medicines are the first line drugs for hypertension, so answer is ACE inhibitors are the first line drugs, calcium channel blockers are the first line drugs, and the third is diuretics, thiazides. So ACE inhibitors, calcium channel blockers, and thiazides are the first line medicines for hypertension. And as a student, you should be knowing the details of these three group of medicines in topic of hypertension. So if we talk about this ACE inhibitors, so ACE inhibitors are the medicines which are resemble to one more group of medicines. We call them angiotensin receptor blocker. So ACE inhibitor resemble the group known as angiotensin receptor blocker. Now ACE inhibitors, all the medicine ends with the word pril, and ARB, all the medicine ends with the word sartan. All the medicine ends with the word sartan. Now, these medicines are given for the treatment of hypertension, that's fine. So, these medicines are given for the treatment of hypertension as a first line drugs. They're also given for the treatment of congestive heart failure. And these medicines are also given as a best medicine for the treatment of proteinuria. So, whenever you guys are losing the proteins in the urine, these are the best medicines to be given for that. Now, apart from this indication, these medicines have some other unique indications which are more important to know instead of the common indication. For example, we have a drug over here. The drug name is losartan. Now, losartan is a drug. This medicine can increase the elimination of uric acid. This medicine can increase the elimination of uric acid from the body. So, this is known as uricose uric drug. So this medicine can increase the uric acid elimination from the body and can be given for the treatment of gout. So this drug can be given for the treatment of gout. The drug name is losartan. Apart from that, losartan also has anti-platelet property. So this losartan has anti-platelet property by inhibiting thromboxane A2 receptor. So by inhibiting thromboxane A2 receptor, this medicine also has anti-platelet property. Now, apart from this losartan, please remember we have a drug known as telmisartan. Now, telmisartan is a drug which has the anti-diabetic property. This medicine has an anti-diabetic property by acting on PPAR gamma receptor. So, by acting on PPAR gamma receptor, this medicine has anti-diabetic property. Next is regarding a drug candesartan. Now, candesartan is a drug. This medicine can be given for the treatment of migraine. So candesartan is a medicine which can be given for the treatment of migraine. So candesartan given for migraine, telmisartan has anti-diabetic property, losartan has property that is gout and the platelets. So students make the mnemonic like this way. Like they remember the mnemonic low pogo. So pogo used to be a very famous cartoon channel, you must be knowing. So low means losartan, po means platelets and go means gout. So this medicine losartan is given for some special indications. Apart from that, you should be knowing the side effect of these medicines. Now, what are the side effects of this ACE inhibitor and ARB? So the mnemonic here is captoprils. So the mnemonic here is captoprils that you have to keep in your mind, right? Now, in this mnemonic, I would say the most common side effect. Now, here the C stands for cough and angioedema. So C stands for cough, right? So cough and angioedema. So these medicines can cause cough and angioedema as a side effect. So C is for cough, A is for angioedema. So the most common side effect of ACE inhibitor. It's a side effect of ACE inhibitor only. These side effects are not seen with ARB. So these two side effects are not seen with ARB, only seen with ACE inhibitor. This is the most common side effect, cough, and the second side effect is angioedema. Now, why this side effect will occur with ACE inhibitor? Due to the accumulation of bradykinin. So, due to the accumulation of bradykinin, this side effect of cough and angioedema will occur. Now, apart from that, these medicines will also increase the level of potassium in the body. So, the medicine side effect is hyperkalemia. Medicine side effect is hyperkalemia. Now, these medicines can also result in orthostatic hypotension. So, ACE inhibitor ARBs can result in orthostatic hypotension as a side effect. Now, this orthostatic hypotension is seen when you give these medicines along with diuretics. So when you give these medicines along with diuretics, this side effect will be more common. That is orthostatic hypotension. The orthostatic hypotension will be more common when these medicines are given along with diuretics medicines. So mnemonic is captopril, C is for cough, A is for angioedema, P is for potassium, right? O is for orthostatic hypotension. We skip T in between, so no matters. T stands for taste change. So these medicines can result in taste change. Now taste change is a side effect that is seen only with captopril. So taste change is a side effect only seen with captopril as a drug, right? The next side effect of this medicine is like in this mnemonic we have the P and R. Now P and R are two contraindication. So these medicines are contraindicated in pregnancy. These medicines are contraindicated in bilateral renal artery stenosis. So in bilateral renal artery stenosis and in pregnancy, the medicines are contraindicated. Now, apart from that, these medicines can cause increase in the level of serum creatinine. So these medicines can increase the level of serum creatinine, and because the medicines can increase the level of serum creatinine, these medicines side effect is high level of creatinine in the plasma. Now these medicines can also result in lal rash. Lal means the red rash. So these medicines can cause red rashes as a side effect. Now this lal rash or red rashes side effect is seen only with captopril. So this side effect is only seen with captopril. That is a lal rash or red rashes. Now there is a drug over here. The drug is olmesartan. This medicine can cause celiac sprue-like enteropathy. So this medicine can cause celiac sprue-like enteropathy. So celiac sprue-like enteropathy is a side effect seen only with olmesartan. So this side effect is seen only with olmesartan, right? So these are the important side effect of these medicines. So these medicines can follow this mnemonic captoprils. In this mnemonic of captoprils, we can find out the medicines can cause cough, angioedema. P stands for potassium. T stands for taste change, O stands for orthostatic hypotension. Then we have a two contraindication, that is pregnancy and renal artery stenosis. I stands for increased level of serum creatinine. L stands for lal rashes or red rashes. S stands for screw-like enteropathy as a side effect. Now the question is which is not an adverse effect of ACE inhibitor. So here the answer is hypokalemia. So dysgeusia means taste change. So these medicines can cause taste change, particularly the captopril, which can cause taste change. So hypokalemia is not a side effect seen with these medicines. If we talk about the calcium channel blockers, so there the important drug is verapamil. So verapamil is very important drug for your exam. Now verapamil is a medicine. This is the only calcium channel blocker which is used as an anti-arrhythmic drug. It is the only calcium channel blocker which is used as an anti-arrhythmic drug. And the most common side effect of this medicine is constipation. Most common side effect of this medicine is constipation. Plus, this medicine can also reduce the cardiac output. And because this medicine can reduce the cardiac output, I should not use these medicines in patients of congestive heart failure. So, verapamil should not be used in patients of congestive heart failure. Now, before moving on to the next question, last point regarding this calcium channel blocker. So, we have a drug over here. The drug name is nimodipine. Now, please remember, nimodipine is a calcium channel blocker, which is a drug of choice for vasospasm that is seen in patients of subarachnoid hemorrhage. So, in patients of subarachnoid hemorrhage, nimodipine is a medicine that can cause vasodilation. So, this medicine can be used. So, nimodipine is a medicine that is given for subarachnoid hemorrhage, right? So, nimodipine given for subarachnoid hemorrhage, verapamil is used as an antiarrhythmic drug. Side effect is constipation, contraindication is CHF. That is all about question number 7. Now, let's move on to question number 8. Now, which drug is useful for the treatment of hemophilia? So, here the best answer is desmopressin. Now, what is desmopressin, guys? Desmopressin is an vasopressin analog. You can see from its name, the medicine name ends with the word pressin. It's a vasopressin analog. So if you talk about this hormone, that is vasopressin. So vasopressin, as the name suggests, this can cause vasoconstriction. This can cause vasoconstriction. The other name of this hormone is antidiuretic hormone, means this can retain the water. So this hormone has two functions. Antidiuretic hormone retain the water, and vasopressin can cause vasoconstriction. Got it? Now, this hormone can act on two types of receptor, V1 and V2 receptor. This hormone has two types of receptor, V1 and V2. Now, V1 receptor is required for vasopressing effect or the vasoconstricting effect, and V2 receptor is required for water retention. V2 receptor is required for antidiuretic property, water retention. Now, we have a drug which is V2 receptor analog. The drug name is desmopressin. So desmopressin is a medicine. This is a V2 receptor analog. Now this desmopressin, by acting on the V2 receptor has one more function. This can result in increased synthesis. This can result in increased synthesis of clotting factor number 8. This can result in increased synthesis of clotting factor number 8 by acting on the blood vessel endothelium. So by acting on the blood vessel endothelium, desmopressin can increase the synthesis of clotting factor number 8. So desmopressin is a drug when given to a patient. This can cause water retention. This can also increase the synthesis of clotting factor number 8. So I can use this medicine in treatment of hemophilia. Although in hemophilia these days we don't use this medicine or less commonly use this medicine, we have discovered the clotting factor concentrates. So directly inject the clotting factor concentrate. But still, like in case the patient requires some drugs, so desmopressin is one of the drug or best medicine can be given after the clotting factor concentrates. Right? So I can say this medicine can cause water retention. So this is a drug of choice for a condition where the patient is losing the water. It's a drug of choice for central diabetes insipidus. This is the drug of choice for nocturnal enuresis. This is the drug of choice for nocturnal enuresis, central diabetes insipidus, as well as this is given for the treatment of hemophilia. So I can use this medicine for hemophilia, nocturnal enuresis, and central diabetes insipidus. Now, this medicine, we have a drug which is V1 receptor agonist, medicine which preferably act on V1 receptor. The drug name is terlipressin. So, terlipressin is a drug which mainly act on V1 receptor, can result in vasoconstriction. Because this medicine can cause vasoconstriction, this is the drug of choice for a condition where the patient blood vessels are dilated at the lower end of esophagus. So, it's a drug of choice for bleeding esophageal varices. It's a drug of choice for bleeding esophageal varices. So bleeding esophageal varices, I can use the medicine terlipressin. So terlipressin is the best medicine for bleeding esophageal varices. Now here they can ask you one more question regarding this ADH availability in the body. So ADH can be present in excess quantity. The syndrome is known as SIADH, or ADH is present in the low quantity. The condition is known as diabetes insipidus. When the ADH is present in excess, we call it SIADH. So here I have to give the medicine which is vasopressin 2 receptor antagonist. Which is vasopressin 2 receptor antagonist. The drug name is tolvaptan. So tolvaptan is a medicine which is a vasopressin antagonist. So you can see the name also, vasopressin antagonist. So AN means antagonist, VAP means vasopressin. So I can use this medicine as the best medicine for SIADH. And diabetes insipidus is a condition where the ADH is low or ADH action is low. This can be of two types. This can be central diabetes insipidus, can be nephrogenic diabetes insipidus. Now, for central diabetes insipidus, we people have already discussed. Desmopressin you will mark as a drug of choice. Desmopressin you will mark as a drug of choice. But for nephrogenic diabetes insipidus, you will mark thiazides as the best medicine. So thiazides can be marked as the best medicine for nephrogenic diabetes insipidus. So question number 8, the best answer is desmopressin. Now, if we talk about the other diuretic drugs, like these medicines will act on this kidney. So medicines have the diuretic property, which are the blocker of vasopressin, or medicines can have the anti-diuretic property, which act like a vasopressin. So other medicines which are important for your exam, which you can read, is acetazolamide. So acetazolamide is a very important drug for your exam. So medicines that will act on PCT of kidney, medicines that will act on proximal convoluted tubule of kidney, we have a drug acetazolamide. Now acetazolamide is drug of choice for mountain sickness. This medicine is drug of choice for mountain sickness. It is an important drug for your exam. Now, apart from that, acetazolamide is a second drug of choice for raised ICT. It is a second drug of choice for raised ICT, and it is a first line drug. It's a first line drug for acute angle closure glaucoma. Drug name is acetazolamide, which is a carbonic anhydrase enzyme inhibitor. Now, the second medicine that will act on PCT of kidney, proximal convoluted tubule of kidney, is a medicine, we call it mannitol. Now, mannitol is a medicine. This is drug of choice for CNS problem, like it's a drug of choice for cerebral edema. It's a drug of choice for cerebral edema. It is a drug of choice for raised ICT. Like acetazolamide is a second drug of choice for raised ICT. Mannitol is a drug of choice for raised ICT and cerebral edema. Apart from that, mannitol is also given for the treatment of post-dialysis disequilibrium syndrome. This is also a drug of choice for post-dialysis disequilibrium syndrome. So post-dialysis disequilibrium syndrome, it is a drug of choice, and this medicine is also given for the treatment of acute glaucoma. This medicine is also given for the treatment of acute type of glaucoma. Drug name is mannitol. So mannitol is also given for the treatment of acute glaucoma. Drug name is mannitol. Now, one of the important contraindication of mannitol is this mannitol should not be given to a patient of CHF with pulmonary edema. So this medicine should not be given to a patient of CHF with pulmonary edema. Drug name is mannitol. Now, the third medicine that will act on PCT of kidney. So we have three medicines that will act on PCT of kidney. One is known as acetazolamide. Second is known as mannitol. Now, the third medicine that will act on PCT of kidney are known as SGLT2 inhibitors. So the third group of medicines are SGLT2 inhibitors. These are the diuretics which will also act on PCT of kidney. And all these medicine ends with the word gliflozin. All the medicines ends with the word gliflozin. Now these medicines are given for CHF as well as these medicines are given for the treatment of diabetes mellitus 2. Now whenever we give these medicines to a patient, these medicines can increase the risk of UTI. Medicines can increase the risk of UTI as well as increase the risk of genital skin infection. So these medicines can increase the risk of genital skin infection, can also result in increased risk of UTI. So these three group of medicines are very, very important for your exam. So if you talk about me, if you ask from me, sir, which drugs are important to read in the topic of diuretics, I would say Guys, go and read about the medicines that will act on PCT of kidney. Plus, you can read about the medicines that will act on this anti-diuretic hormonal pathway. So these are the important topics for your exam regarding this topic, regarding the drugs that will act on kidney. This is all about question number 8. Let's talk about question number 9. A patient of prosthetic cardiac valve taking warfarin. Right now, this patient has come to you with bleeding. It means the warfarin overdose has been happened. Now, which medicine is given for the immediate management? So, any patient who will come to you with bleeding because of warfarin overdose. So, any patient who is bleeding with warfarin overdose, although we have an antidote vitamin K, but this vitamin K is a slow acting antidote. This will take long time to act. So, immediately we have to give the clotting factor infusion to this patient. So we can give fresh frozen plasma. So fresh frozen plasma contains all the clotting factor. This can stop the bleeding immediately. This can stop the bleeding immediately. So please remember, warfarin is a drug which is given to a patient as an anticoagulant medicine. And whenever you give warfarin, we have to monitor this parameter. We call it INR. So warfarin monitoring, warfarin toxicity monitoring is done by a parameter, we call it INR. The antidote of choice is vitamin K, but vitamin K is a slow antidote, slow acting drug. So whenever the patient is bleeding, it's an acute emergency. We have to give the medicine that is fresh frozen plasma to this patient along with vitamin K. Now, this question is based on the drugs which are known as anticoagulants. Now, anticoagulants is a very, very important topic for your exam. So, if we talk about anticoagulants, we can divide anticoagulants in two groups. First group of medicines are directly acting. Second group of medicines are known as indirectly acting. Now, the medicines which are directly acting, they are inhibitor of clotting factor number 10A directly, or they are inhibitor of clotting factor number 2A directly. Now, the medicines which are inhibitor of factor 10A directly, all these medicines are given by oral route, and all these medicines have XA ban in their name. So all the medicine ends with a word ban. So they are going to ban something. And what is that the medicines are going to ban? The answer is factor 10A. So these medicines are going to ban the factor 10A. So all these medicines ends with the word XA ban. They are given by oral route. One example of the drug is apixaban. One more example is like rivaroxaban. So these are the medicines which are factor 10A inhibitors given by oral route. Now we have drugs which are factor 2A inhibitors. Now these medicines can be given by oral route, can be given by IV route. So the drug that is given by oral route, the drug name is dabigatran. So we have a drug name is dabigatran. This is given by the oral route. And the medicines which are given by the IV route, medicines names are ergotroben. Medicines names are ergotroben, and one more drug is bivalirudin. So bivalirudin. So we have a drug. The drug name is bivalirudin. So the medicine is bivalirudin. So there is some technical glitch over here. So we call it bivalirudin. So bivalirudin, ergotroben are the two medicines which can be given by IV route, and dabigatran is a medicine that is given by the oral route. Now, if we talk about the medicines which are the indirectly acting medicines, now indirectly acting medicines are of two types: medicines which are given by parenteral route, medicine that is given by the oral route. Now, the medicine which is given by the oral route is warfarin. This medicine is inhibitor of vitamin K dependent clotting factor. This is inhibitor of vitamin K dependent clotting factor, and the drug that is given by parenteral route are known as low molecular weight heparin. So, low molecular weight heparin given by parenteral route. All this medicine ends with the word parin. All the medicine ends with the word parin. One classical example of a drug that ends with the word parin is enoxaparin. So one example is like enoxaparin. These are the heparin indirectly acting medicine. Now this topic is very important. So I suggest you go and read this topic in detail. Anticoagulants. Now apart from anticoagulants, there is one more topic which is very important is antiplatelet drugs. Well, antiplatelet drugs, as a dentist student, you have to read two medicines in detail. One is known as aspirin, second is known as clopidogrel. So aspirin and clopidogrel need to be discussed in detail. Where aspirin is FOX1 inhibitor, clopidogrel is P2Y12 receptor inhibitor. So aspirin is FOX1 inhibitor, clopidogrel is P2Y12 inhibitors. Now apart from that, we have a group of medicines, we call them thrombolytic drugs. Now, thrombolytics are those medicines which are enzymes. So, all the medicine ends with the word ase, like streptokinase, urokinase, LT-plase, retiplase. All these medicines are also having the word T-plase in their name. So, tissue plasminogen enhancers. So, we call them tissue plasminogen enhancers, right? They can also ask you the antidotes of thrombolytic agents. So, in this MCQ, they have given you the antidote of thrombolytic agents. So the antidote of thrombolytic agents can be, we have a drug like IAPA, epsilon amino caproic acid and tranexamic acid. So tranexamic acid and epsilon amino caproic acid, these medicines can be used as an antidote of thrombolytic drugs, which are the tissue plasminogen enhancers and can dissolve the clot, can cause lysis of the thrombus. So this topic is also very important for your exam. So let's move on to question number 10. So which medicine should not be given to a patient of peptic ulcer disease? So here the answer is indomethacin. So indomethacin is a non-selective COX inhibitor. This is a non-selective COX inhibitor. It's a type of a NSAID, non-selective COX inhibitor, and this medicine can result in side effect like GERD and peptic ulcer disease. That's why this is not given to a patient of peptic ulcer disease. Now, paracetamol is not an NSAID. This is different from NSAID. This has analgesic property, antipyretic property that is not associated with inflammation. So this medicine has no anti-inflammatory property. This will not cause this kind of side effects. But whenever there is a paracetamol toxicity, patient will have the liver damage, and the antidote that we can use for paracetamol toxicity is N-acetylcysteine. So N-acetylcysteine is the antidote of choice for paracetamol toxicity. So if we talk about this medicine, celecoxib. Now, any drug that ends with the word coxib, this is a selective COX-2 inhibitor. This is a selective COX-2 inhibitors, and any drug that ends with the word coxib has one advantage and one disadvantage. Has one advantage and one disadvantage. So what is the advantage? The advantage of selective COX-2 inhibitor is they will not cause GIT side effects. But the disadvantage is they can increase the risk of coronary artery disease. So these medicines can promote platelet aggregation, and by promotion of platelet aggregation, they can result in increased risk of MI and angina. But advantage is they will not cause GIT side effects. Now, amoxicillin is an antibiotic, right? So this amoxicillin, which is a beta-lactam antibiotic, is a beta-lactam antibiotic, and in India we use this amoxicillin more commonly with clavulanic acid. The combination is known as amoxiclav. Now, this amoxiclav will not cause these kind of side effects like peptic ulcer disease or GERD. The amoxiclav is a wonderful antibiotic. It's a drug of choice for dental surgery prophylaxis. This medicine is drug of choice for dental surgery prophylaxis. So any patient who is undergoing the dental surgery, if he wants to take some antibiotic, amoxiclav is the antibiotic of choice that can be taken before any kind of dental surgery. Now, apart from this indication, this is also drug of choice for otitis media. This is also a drug of choice for otitis media. This medicine can be given as a first line drug. This medicine can be given as a first line drug for community acquired pneumonia. Medicine can be given as a first line drug for community acquired pneumonia. Can be given as a first line drug to those patients who have the skin infection or the soft tissue infection. So can be given to a patient of soft tissue infection, skin infection, or these medicines can be given for the treatment of UTI. Amoxicillin can be given for the treatment of UTI treatment. The amoxiclav is important drug for your exam. Now, indomethacin, if we talk about in further detail, the answer of this question is indomethacin. So you can find out indomethacin is a drug. Indomethacin is a medicine. Now, this medicine has multiple mechanism of action. Now, this medicine is a non-selective COX inhibitor, but this medicine also take entry in CNS. And by taking entry in CNS, this medicine can inhibit the CNS pathways and can be used as a painkiller. Now, this medicine can result in CNS side effect also, which is unique to this painkiller. Now, what this medicine can do, this medicine can cause insomnia, this medicine can cause vertigo, and to a surprise, this medicine can result in headache also sometimes. This medicine can result in headache, vertigo, insomnia as a side effect. That is, drug is indomethacin. We talk about some other painkillers. For example, we have a painkiller, we call it piroxicam. Now, piroxicam is one more non-selective COX inhibitor. Now, this medicine is a long-acting NSAID. This medicine is a long-acting NSAID because this medicine undergoes enterohepatic circulation. And because this drug will undergo enterohepatic circulation, it is one of the long-acting painkiller. Drug name is piroxicam. And apart from this piroxicam, guys, please remember nimesulide. Nimesulide is a drug. This medicine can cause hepatotoxicity as a side effect. So this medicine should not be given to children. So nimesulide is contraindicated in children. Now, apart from that, there are two medicines. One is known as diclofenac. One more drug is aceclofenac. So diclofenac, aceclofenac are two medicines. Now, these medicines will deposit in the joint. So they will achieve high concentration in the joint space, in the joints tissue. And therefore, these medicines can be given for the treatment of arthritis. So these medicines can be given for the treatment of arthritis. So guys, these are the total 10 questions that we people have covered over here, right? So what I can think are important can I have covered over here. So in case you people have any doubt, any query, you can directly message me on this number, right? So 9999663325. So this is the WhatsApp number. So in case you have any WhatsApp query, you can call, you can message me over here directly. And in case you people are people want this PDF, whatever I have written over here, that is an annotated PDF. So I can share this PDF with you also, right? So guys, take care of yourself and study hard for your exam. So we are always with you. We are always there to care for you. In case you have any difficulty, please reach out to us any time of the day. So we are there always for you. Take care of yourself. All the best for your exam.